As a brain doctor, I am begging seniors to stop this shower habit. This can cause blood clots. Welcome back to our channel. As a professional, I want to discuss something that many people do every day, but do not know how dangerous it is. In this case, we're talking about showering. For most people, showering is a great habit. It keeps us clean, prevents body odor, and helps maintain good hygiene. However, there are certain things you should never do in the shower, especially if you are a senior citizen. And today, I will tell you why. Now, before I explain why, please take a moment to subscribe to my channel. Just click on that button so you won't miss out on any health tips for a happier and better life. Also, be sure to like this video and share it with your friends so they can benefit from what I am going to share. Now, let's get started. First of all, as a brain doctor, I have seen firsthand how many seniors suffer from stroke and other vascular problems due to blood clots. Blood clots can be caused by a number of factors, including age, genetics, and medical history. But did you know that there is also one more thing that can increase your risk of developing blood clots? Taking long hot showers or baths. Now, you may be thinking, what's the big deal about taking a shower? We all need to wash ourselves, and staying clean is important for our health. Well, here's the thing. When you take a hot shower or bath, your body temperature rises rapidly. This causes your blood vessels to expand, which makes it easier for blood to flow through them. At the same time, your heart rate increases in order to pump blood faster. These changes can put a strain on your heart and make it harder for it to pump blood effectively, which can lead to blood clots. It is well known that older adults are at an increased risk of developing blood clots because their blood tends to be thicker than that of younger people. When you combine age with hot showers, you double your risk of developing blood clots. On top of that, if you already have a medical condition that affects your blood flow, such as high blood pressure or diabetes, then things become even more risky. Many studies have shown that taking hot showers or baths can lead to blood clots. In fact, some studies have even linked hot tubs and saunas to the formation of blood clots. The reason for this is simple. When your body is exposed to high temperatures, it causes your blood to become more concentrated and viscous, which makes it more likely to clot. This is because when blood is heated, the proteins and other components that make up its plasma expand, causing the blood to thicken. Additionally, high temperatures can activate certain clotting factors in the blood, further increasing the risk of clot formation. It's not just the temperature of the water that matters, but also the length of your shower. Studies have found that taking showers that are longer than 30 minutes can also increase the risk of blood clots. Prolonged exposure to heat can dehydrate your body, which can make your blood more concentrated and thick, leading to a higher risk of clotting. So what exactly is the ideal shower temperature and duration for older adults? According to experts, the best temperature for a shower is between 98.6 and 104 degrees Fahrenheit or 37 to 38 degrees Celsius. The duration of the shower should also be kept in mind, and it should not exceed 20 minutes. Staying in the shower for too long can cause dehydration and make the skin dry, which can lead to irritation and even infection. I know that many people love to spend hours in the shower, especially when they are retired and have all the time in the world. However, it's important to remember that as we age, our bodies change, and what may be comfortable for us in our younger years may become dangerous in our later years. As a brain specialist who treats stroke patients, I can tell you from experience how devastating it is to see someone suffer from a stroke and how it can affect their life and the lives of their loved ones. Many patients and their families tell me that they had no idea that something so simple could cause such a serious problem. If you are concerned about the risk of blood clots, you should talk to your doctor about ways to prevent them. One way to reduce your risk is by staying active and exercising regularly. Exercise helps to keep your blood flowing smoothly and reduces the risk of blood clots. If you are unable to exercise, then at least get up and move around every half an hour when you are sitting for long periods of time. Sitting for long periods of time can make your blood more likely to clot. So getting up and moving around can help keep your blood flowing and reduce the risk of clots. Another thing you can do is drink plenty of water throughout the day. This will help keep your blood from becoming too concentrated and thick, which can lead to clots. You should also avoid smoking and secondhand smoke, as tobacco smoke damages the lining of your blood vessels and makes it more likely for clots to form. There are also some medications that can help reduce the risk of blood clots. If you are at high risk for clots, Then talk to your doctor about whether or not you should take these medications. One common medication used to prevent clots is called warfarin, which is also known as warfarin is a blood thinner that helps to reduce the risk of clots by preventing the blood from clotting to However, it is important to note that warfarin is a potent medication, and it is essential to take it exactly as prescribed by a doctor, since an overdose can lead to excessive bleeding. Therefore, if you are considering taking warfarin, it is important to weigh the risks and benefits carefully and follow your doctor's instructions closely. Another medication that can be used to prevent clots is a class of drugs known as direct oral which includes medications such as apixaban, rivaroxaban, dabigatran, edoxaban, and vetrixaban. These medications are newer than warfarin, and they offer some advantages such as a more predictable dosing schedule and fewer drug interactions. However, they can also be more expensive, and they may not be suitable for everyone. For example, some of these medications can interact with other drugs you may be taking, such as those for high blood pressure or diabetes. They can also cause side effects such as bleeding and an increased risk of stroke. Ultimately, the best medication to prevent clots will vary depending on the individual and their specific circumstances. It is important to work closely with your doctor to determine which medication is right for you. And now, I would like to hear from you. What do you think about what I shared? Have you ever heard of these shower dangers? Let us know in the comments below. And finally, please do not forget to subscribe so you can be informed whenever I post new videos. Thank you for watching. Stay healthy, and see you soon. As a brain doctor, I am begging seniors to stop this shower habit. This can cause blood clots. Did you know that taking long, hot showers can be dangerous for seniors? It can increase the risk of blood clots due to rapid increase in body temperature and heart rate, which puts a strain on the heart. Experts recommend keeping shower temperature between 98.6 and 104 degrees Fahrenheit, or 37 to 38 degrees Celsius, and limiting the duration to 20 minutes. Older adults should also avoid spending more than 30 minutes in one place, and should get up and move around every half an hour to keep their blood flowing and reduce the risk of clots. Other preventive measures include drinking plenty of water, avoiding smoking, and secondhand smoke. And talking to your doctor about medications that can help reduce the risk of blood clots. Remember, small changes can make a big difference in keeping you healthy and safe. Stay smart. Stay safe.